Hello, welcome to Paging America, where we explore the power, profit, and politics shaping American healthcare and what you can do about it. I'm your host, Miles Baker, along with Dr. Rob Davidson. How you doing today, Rob?
I'm doing okay, Miles. Heading into spring. The world has a new pope, first American pope.
First
The
American
Maha
Pope.
movement
Yep.
is apparently just in full bloom here in the spring, too. So I think we're going to talk about that. So I guess doing
Yeah.
okay.
Doing okay. Okay. I think, yeah, all things considered, I'm doing okay. I'm on a little vacation right now, but we're still finding some time to record, particularly because we have a very troubling development out of the Surgeon General's office, or the nomination for the new Surgeon General. So that's what we're going to be covering today, folks. We got a good show. We're going to briefly cover the Surgeon General nomination out of the Trump administration, and we are going to talk about a little bit of an update on the fight for Medicaid. And we have some big developments this week and want to cover that. And we may tack on a few other things, but those will be our main topics today. So, Rob, I'll be honest. I had to read a little bit about what the Surgeon General does. So, just like textbook definition, the Surgeon General of the United States is the operational head of the United States Public Health Service Commission Corps. And what I sort of know the Surgeon General to be is the main spokesperson for public health. But you're a medical professional. I'm not. How does the Surgeon General relate to you and other physicians?
Yeah, I mean, that is true. I mean, obviously, it's not something we do on a regular basis, but most of us in our clinical practice are just sort of busy seeing patients, right? Busy managing practices or groups and just taking care of people and practicing evidence-based medicine, hopefully. And so we rely on the Surgeon General as kind of a mouthpiece of what we all do to the public, right? And then sort of helping set the tone for what they think, and hopefully the collective wisdom of healthcare in this country thinks are some of the important things we need to be talking about. And sometimes maybe in things we hadn't been talking about. Our Surgeon General, the last one under Biden, Dr. Vivek Murthy, who also was Surgeon General for a period of time under President Obama, who was previously an internist. I think he talked a lot about, kids and devices and loneliness, right? And kind of the isolation, particularly coming out of COVID in the US. And I think certainly an important topic. We all felt a little more acutely during the pandemic. Our kids probably felt it more than we did, and maybe we couldn't understand that in them. And I think really did an important thing highlighting that, bringing that to the fore, and was much appreciated. C. Everett Koop got the notice on, that was, I think it was Reagan or Bush's, or both. Surgeon General got the little notice on packages of cigarettes saying the Surgeon General says these cause cancer, right? Kind of a big deal. I think that was pretty cool, pretty important, right? Something we all kind of knew. People called them cancer sticks back in the 60s and 70s. And yet having this official label brought to you by the Surgeon General of the United States was a very important moment, kind of leading into the tobacco, litigation and big tobacco pay the price for killing people when they knew they were killing people and doing it on purpose. So yeah, it's a real thing. It's kind of a big deal.
Important feature. He was the Surgeon General under Reagan and
Very
Bush
good.
one.
All right.
So it looks like after a first failed nomination for Surgeon General, that the new nomination is a wellness influencer out of Los Angeles,
Yeah.
with no public health experience and who did not complete her residency, and it is pretty troubling. I wonder if we want to, maybe before we get into the details on it, Donald Trump was asked about the nomination because it is such an unorthodox / crazy, whatever you want to call it, unorthodox or crazy nomination. Maybe we can see how he reacted.
Here we go. All right. So just a brief little clip. They asked why, did you pick her? And he said, well, Bobby thought she was fantastic. I'm assuming referring to Bobby Kennedy, RFK Jr. So Dr. Casey Means, right? She's a doctor. She graduated medical school, I believe Stanford. I believe started a surgical residency and did not complete it. That's fine. People do that, right? People make career decisions. Honestly, particularly in medicine, you kind of make that decision around age 19 or so when you decide to track into pre-med. And by the time you get to residency in your mid to late 20s, some people just sort of say, yeah, this was the wrong turn. I mean, people change careers every couple of years sometimes. And that's fine if that's what you want to do. It's highly unusual and a little scary and just plain weird that then that person would ascend to the top doc post in the United States government, heading up all of public health and being the spokesperson for all of us, right, to the country. That's where we've got a problem. No problem that this person didn't finish residency. Residency's hard. I had an ER residency, not as hard as a surgical residency, which she had started. I mean, those folks are on every third night for 5 straight years, a lot of surgeons turned out to kind of be assholes at the end. And I was blown away when I just did a couple of rotations in surgery thinking, why aren't they all that way? My God, like it's brutal. It's brutal. So hey, all props. You don't have to finish your residency. You don't have to be a doctor. That's fine. You probably shouldn't be the Surgeon General. But it's not just that, right? Like she's done some kooky things since she entered her medical career.
So when she ended her medical career, she went on to found something called Levels, which is a wearable health monitoring device, an app that earns money promoting supplements and claims in creams and teas and all sorts of goofy stuff. On LinkedIn, she describes herself as a former surgeon. A former surgeon turned metabolic health evangelist. 37 years old, has never practiced in public health in any way. She has a newsletter that says embrace the woo-woo, aka the mystery, doing full moon ceremonies, work with spiritual mediums, connect to spirit guides. She has trees for guidance. Here's the thing on that, Rob. I don't mind if someone is a little woo-woo and is having fun with some alternative stuff. More power to you. I think if someone is promoting that and talking about it all the time, I can think of about 1 million jobs that they'd be better at than Surgeon General.
Well, I mean, that's where we go here, right? I think metabolic aspect of medicine and health is really important. I mean, I think, a lot of it talks about, and the whole Maha, I hate even saying it, but the whole Maha movement, that's the problem, that sometimes they say things that you can't argue with. People should get out and get more sunlight. Absolutely. We should have fewer pesticides. We should not have toxic chemicals in our food chain. Absolutely. We should rigorously test the things that we recommend people put in their bodies, like vaccines. Guess what? We do. They have been. They've been shown to be safe. But if you come out against the movement or the kind of kooky folks that rise to the top of the movement, then you get labeled as, oh, well, you're just part of the process. You have no idea how many times I've been called a pharma shill, a big insurance shill. Like these people don't know that like I help run an organization, the Committee to Protect Healthcare, that like is fighting big pharma in multiple states and federal advocacy because big pharma is like ripping people off with high drug prices. That we're fighting health insurance companies that are ripping people off with high premiums and not covering anything. We're fighting hospitals in some fronts because of consolidation and them bilking money from Medicare and fighting for something called site neutral payments where they get paid the same amount as everybody else. We are also saying we need evidence-based medicine, right? We need that along with promoting health.
I'm really surprised about this one. So I want to talk a little bit about her book because I'm not sure we've fully made the case at how silly this nomination is. So she has one main book that she sells on her website. I haven't read the book, but we looked at it online. And the book's central claim is that depression, anxiety, acne, infertility, insomnia, heart disease, erectile dysfunction, type 2 diabetes, Alzheimer's disease, cancer, and most other conditions are caused by a single mechanism, which the author, her, calls bad energy, which she describes as an unspecified metabolic disorder, which she claims show up in different cell types and thus cause different symptoms. Rob, you finished residency. Did you ever run into someone with bad energy?
God, I do it all the time. I'm calling people on the phone, calling consultants, and they're 3:00 in the morning, and they're in a bad mood. There's some bad energy going on between us for sure.
Okay, but nothing diagnosable as bad energy, right?
Again, that's the thing, right? Are there things happening in the human body and its connection with nature and its connection with things we ingest that we can't explain? 100%. Sure. Nearly every shift, I talk to someone about a potential cause of their symptoms as idiopathic. Idiopathic means we don't know, right? I say idiopathic means we're idiots. We don't know. And that's okay. We have to be okay with that. Would you want to call it something? Call it bad energy? Yeah, sure. Right? But we also know I had a gentleman having a massive heart attack my last shift an hour before I left, and we had to, zip him down to the heart cath lab to get a balloon in his artery. We also know that was not caused by bad energy, right? That was caused by likely a combination of genetic predisposition, high blood pressure, high cholesterol, diabetes, causing damage to an artery in his heart, causing plaque, causing a clot to cause no blood flow. Like we know that it's been studied. We know how to treat it. We know how to partially somewhat prevent it. We don't have to just conjure up some term to sell a book to say that's the cause of this guy's heart attack. It's, again, it's silly, but then it goes from silly to dangerous when you put that person in a
Really
leadership role like this.
Yeah.
Let her write books, have a newsletter, have a website, like have a sweat lodge, sing to the trees. I don't care. Maybe I probably would enjoy a sweat lodge. That sounds very, rejuvenating. Don't put that person in charge. Yeah.
Don't give that person the federal machinery of the United States government.
Right. And it gets down to like all of these folks, Bobby Kennedy, now Dr. Means, all of them making a buck off of all this, right? It isn't just that they're out there espousing the views for the goodness of society and they're making profits. One of her titles on her LinkedIn is entrepreneur, I believe. Yeah. That's great. That's great. But she and her brother wrote the book together. He's not a health person. They're just people who make money. And that's what this has become. And my other big problem with this, and we're going to talk about Medicaid a little bit later, is they then have thrown their lot in the Maha crowd with sort of MAGA Republicans who are trying to gut Medicaid, who are trying to gut the ACA, who are trying to, private and have successfully privatized more than 50% of people on Medicare for profit. And so they're doing all these things and then they're saying, well, we're promoting health, we're with people. And then they're with one hand, and on the other hand, throw their lot in with people who are completely devastating people's ability to afford healthcare. It doesn't jive for me. I think for most rational people who look at it and think about it, it doesn't jive. So what? Yeah. What's the reason, right? What is the reason Trump is thrown in with these folks so hard and heavy and letting Bobby make the call and not having ownership?
Yeah, I think personal profit is certainly a motivating factor here. We sort of dig at, and like the grift is as big as like the weird Bitcoin scams or not cryptocurrency scams that they're running at like the Trump family level of the federal government. But almost all of these folks that are looped in with Bobby Kennedy are making money in the Maha space. It's like, we might be talking about vaccines to get you to bring you to the website. Now all of a sudden we're talking about supplements. And guess what? I have a great supplement for you. And I would love to learn more about the sort of sales on these things, because it seems like they all have some list of semi-magical supplements that they're hawking off these websites. I'd love to understand their sales better, because I don't understand the scale of the grift. It's a grift. You read the website, you're like, oh, they're just pitching me on their stuff. Right, but like, it'd be interesting to understand the scale. I think the more insidious part, I think the scarier part for me, because like if people are, the Trump family scamming so much money that it seems like any other grift that's happening here is like small ball compared to the billions in cryptocurrency that's getting raised with the shitcoins. But the more insidious piece of this is it's pretty obvious that Robert Kennedy Jr. is like not equal among the other. He's at an elevated position among the other cabinet members, because I'm going to venture a guess. It's hard to be inside this guy's brain, in Trump's brain, but it has been reported on a little. They believe that the Maha movement is an important part of the like MAGA coalition, and that by having these folks lead these agencies, be public communicators, stir up controversy around vaccines that shouldn't exist, or stir up controversy around the FDA or HHS or sort of wherever they're drawing cameras and eyeballs online, that they think that these characters are an important part of their political coalition and will be an important part of their political coalition for the midterms. I'll just also say one thing. I don't think they're wrong. It's a lot of women in the suburbs. It's a lot of people who are worried about their kids, and maybe just 10 years ago, they're worried about their kids and the quality of the public education that they're going to receive. And the Democrats are going to win on that one. And now they're worried about their kids. And then they're searching for different answers, or sort of like these Maha vibes answers that are coming out of these health influencers. It's not great that they've set it up this way, because I worry that it could work.
Yeah. What we got to do though, right, is remind people like the number, and I don't have the number in front of me, the number of deaths from respiratory illnesses because of air pollution, right? The number of people displaced from homes, the changes in vector-borne illness, the amount of Lyme disease that I've seen this year or last year into this year now in Michigan trillion that we've never seen before, probably
Yeah.
based somewhat
It's
on
getting
global
warmer.
climate change and global warming. That is such a threat to people's health, such a threat to public health, right? Clean water, clean air is such a critical component of people's health every day that they just don't see on a daily, regular basis. And, Trump's EPA is trying to gut the standards that keep our water and our air clean. And so, like, if the Maha movement fully embraced all of that, then they would not be welcome in this coalition, right? There would be some real tension between the kind of industrialist, pro big oil, that piece, right? And then
Of their
this,
coalition,
kind of the
yeah.
actual healthcare piece. So I guess they're just choosing to live in this silo, the Maha folks, and being willing stooges for Trump and Republicans that are kind of propping them up, while they know damn well, or they must know damn well, that those environmental pieces are killing people in numbers that probably by orders of magnitude dwarf anything that red dye has done. I would venture to guess. This is not a healthcare intersection with politics podcast. This is not, I'm not giving you real data here. I don't have the research, but I would venture to guess like air pollution has done more damage than red dye to the health of this nation. So anyway, that is concerning. I agree. And I knew you had a thought on that. And you're the political expert on this show. It's important.
We'll keep following this. So we're going to dig in a little bit more to try to better understand who the Maha faithful are, to understand the politics of that coalition. I suspect that they've really dug into it. It's probably time on the other side of the ledger, those who us are, whether center right, center left, but in opposition to Trump's administration and what they're doing to healthcare, that we dig in a little bit to understand how we can persuade some of these folks back and dislodge them from the reality distortion field that they're seeing on Instagram.
Yeah. And we also have to bring the receipts to say, look, here are the things we're actually fighting for that do improve public health, that improve the quality of our air, our water, our food supply, our supply chain for medications and drugs and all that. We can't just be decrying their kookiness, because their underpinning of all of that is to say, we need to support healthy lifestyles. I guess that's the other piece. I mean, Pete Buttigieg, I think, as transportation secretary, he was pinned as being, he's DEI because he talked about environmental or what did he talk about? Infrastructure type racism, where they build highways through entire communities and separate these communities and make them less walkable. And, and we talk about kind of trying to reverse that trend to promote health, to promote people walking more and having that kind of lifestyle that promotes health in a better way. We gotta talk about all of it together and show the Maha folks, the suburban moms, that we are on your side of keeping your kids healthy. Absolutely, communities in Michigan. Communities in Michigan, I know, tried to ban plastic bags, right? Because those are terrible for the environment in which we live, to promote health. And the state of Michigan under Republicans banned their ability to ban those things in their communities. Like, it goes up and down the line. We do have the receipts. We just need to be better at bringing it to the conversation and letting people know kind of what we're actually fighting for.
I don't think I'm not gonna pick that plastic bag fight though, Rob. That's not what I'm gonna pick.
No, okay, all right. Yeah, and then the other piece of the news here you brought up was like Medicaid, right? Looks like Medicaid might be alive. Like Medicaid might become another third rail, like Social Security, that you just don't touch because you face the wrath. Talk about that.
Yeah. So first, before we start off, I know that mainly the folks who listen to this are physicians, and a lot of activist physicians who have been taking action in congressional districts in their own communities. From a person who's also working on that project, thank you to everyone who's working on that. Keep it up. So it does seem like some good news. Cracks in the attacks on Medicaid began appearing this week, pointed out by Politico on May 1st. Look, if Republicans follow through, 10 million Americans or more could lose their health coverage. According to some estimates GOP lawmakers have reviewed, that's a possibility that has made President Donald Trump and his top aides nervous. They're now seeking alternatives that would still allow the GOP to finance the massive tax cut without throwing 10 million, maybe more, off the healthcare rolls. Trump was interviewed by Christine Welker on Meet the Press this week, asked if he would veto a reconciliation bill if it contained cuts to Medicaid. He said, I would if they were cutting it. But they're not cutting it. They're looking for fraud, waste, and abuse. Ding, 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 ding.
Boom, there you go.
That means they're trying to cut it.
Yeah, for sure. For sure.
So yeah, and they're just going to call it fraud, waste, and abuse. So the Republicans came up with two different approaches. The first is to lower the amount the federal government pays in states and expand Medicaid under the Affordable Care Act. And the other is to limit the per capita spending in those states. Congressman Chip Roy sent a Dear Colleague letter signed by 19 others pushing the idea. Okay, before we get into the next steps on this, what would...
What the hell's a
yeah,
Dear
go ahead.
Colleague letter? What the hell's a
A
Dear Colleague
dear
letter?
colleague, dear colleagues, please
God, it
throw
makes
all these kids off healthcare.
these
It's
people
quite a
are
letter.
so weird.
Yeah.
Okay.
So Mike Johnson threw cold water on both the approaches. It sounds like the next day the Congressional Budget Office issued a report saying that the cuts they are contemplating would indeed save billions of dollars, but they would also leave millions of Americans uninsured. Last update, seems like it's been confirmed. Last Thursday, the House Energy and Commerce delayed a key vote on the reconciliation bill due to disagreements over Medicaid cuts. So just to recap, the timeline they were trying to do this on has been pushed way back. It has been pushed back into the back half of this month, and we can keep pushing it back. That every day that goes by makes it harder to cut Medicaid at the rates that they want to cut it. Every moment that we steal back from them without these cuts going through makes it more challenging because the heat is on. There's events all over the country. And the longer it's in the news, the more it sinks in what the project is. The project being take 10 million women, families, children, toss them off the rolls and give a tax break to their buddies.
Yeah.
Anyway, what have you been seeing out there? How are you feeling about the fight as it stands?
Yeah, I mean, it is encouraging. The problem is when they say waste, fraud, and abuse, you're right. That's them signaling, we're just going to do what we need to do to get the tax cuts for our billionaire friends. And we're going to call everything we do waste, fraud, and abuse. And then if, say, the opposition, Democrats in Congress, or if advocates like us or others are out there kind of suggesting, that they're going to actually hurt people, well, they're going to then paint those people as people who are supporting waste, fraud, and abuse, right? They're just into the bloated government, all right. They're trying to create a worse administrative state, right? More red tape, bigger government when it comes to their so-called work requirements, right? The vast majority of people on Medicaid work. And in any state that they've tried this, what they found was no more people worked, more people who deserved having Medicaid lost Medicaid. It's just the way it goes, right? They're trying to talk about per capita caps. And basically what that says is, irrespective of what the actual spending is, we're going to say per person you have enrolled, here's how much we're going to give you, and we're setting it at that. And so if a few more people get cancer, dear God, look at what happened with the pandemic. We had a twofold crisis of unemployment, an economic crisis happening at the same time as a healthcare crisis. If we had block grants or per capita caps or those kind of things in place during that, can you imagine the millions of people across this country who would have been left without employment, right? Without a way to support their family. And then also the inability to actually go to the hospital when they were sick. How many more people would have died? This is not just little, math for these guys to do in committee. This is real lives we're talking about. So I guess I'm encouraged that it seems like the pressure is working. It's happening. We know we've been a part of it to some extent. So many others have been a big part of it. Governors of red states are telling us this. I know here in Michigan, back when Rick Snyder was governor, Republicans controlled everything, and they expanded Medicaid. Because it was the right thing to do, because it saved people's lives, it saved money. If a study just came out here in Michigan, if the cuts they're talking about go through, 700,000 people in Michigan could stand to lose their Medicaid coverage. I've said this before, my hospital would probably close, right? Or it would severely scale back the services it provides to people. And it doesn't just close for people on Medicaid, it doesn't just scale back services for people on Medicaid, it scales back services for the entire community. That's going to happen all across this country.
Yeah, and the ER wait times going up seems like that would be a thing. I don't know exactly the economics of that, but it seems like it very obvious people start using the ER as opposed to doing sort of going in when they should before they're very sick or catastrophically sick.
Right.
I think it's fascinating to watch this caucus play out on the Republican side because you have these 19? Yeah, the 19 Republicans that are sending the letter saying we want steepest evil cuts to Medicaid that throw the maximum amount of women and children off the rolls. And then you have the folks who have to go win re-election in seats that maybe Trump won by a little bit or Kamala Harris won by a little bit or were close in any of the midterms, and they're saying no to the Medicaid cuts. At last count, that was at least 12 GOP members. I suspect that number is climbing, at least in private. I don't know how they reconcile it. I mean, I know it's reconciliation, but I don't know how they
Yeah.
reconcile this in reconciliation. I think they're really in a trick box with the budget numbers that they've laid out, and then the way that the sides have sort of formulated. And what I would say is for all of us, maximum pressure on
Yeah.
those folks who who are important in committees, Energy and Commerce Committee, other committees. If they're important in committees, maximum pressure on them, maximum pressure on leadership so they know people are paying attention to Medicaid. Anyone who's in a district that has ever swung back and forth, D
Yeah.
to R or R to D, anyone is in the maximum pressure on those R's because they are going to be the ones that are going to unfortunately decide the fate on Medicaid here. And it seems like the pressure's working. So
Yeah.
maybe
Yeah.
a little positive note for the end of the cast today, because it seems like there's a real path to save Medicaid. Don't count our chickens before they're hatched, but there does seem like there's a path.
Yeah, I think that's great. And I've had a number of folks reach out to me, physicians in places where they aren't swingy type districts, but they still want to be out there
Yeah,
and people are still, and my thing is, hell yeah,
do
like
it.
critical mass, do it everywhere, right? Because then it starts kind of creating these big national headlines of even in an R+30 district where that person has no political reason to cave and to care about the tens of thousands of people in their district who would stand to lose healthcare. It's at least creating this. Yeah, I mean, it's helping build that narrative of what people are really feeling, no matter where you live. Because we got to remember, in a 70-30 Republican district, there's still a critical number of people who are on Medicaid who voted for Democrats and Republicans. Probably more of them voted. I mean, again, the place where I work, 70-30 Trump voters, and a huge, huge, huge Medicaid population. Most of those people voted for Donald Trump. Politics just doesn't come into play when they come into the hospital. It never does, never has. I'm very politically outspoken, and people know that. And even in my community, they know that. Guess what? When we're just sitting there talking about them having a heart attack, nobody cares. I had a guy come in with a MAGA hat on once, and the paramedics knew, and they told him, "Oh, Dr. Davidson's on." And the guy looked at me and said, "Oh, do you care about this hat?" I said, "I don't care about this hat. What brings you here?" And he's like, "All right, cool." And then
Yeah,
that was it. Like it was a
yeah,
half a second of a non-conversation, and then from there just came, "Let me take care of you and help you get through this crisis." What you are describing though is these Republicans, it seems, in these very swingy districts, contemplating what could happen in November of 2026, right? It hasn't, in
yes,
most cases, hasn't been brought up explicitly, right? But they know that's there. And then on the other side, you have these folks in the very, very red districts kind of having to toe the line and do the bidding of the administration because they've been warned, if you don't do that, we're going to primary you and get someone else in there that
yeah,
will do what we want. Yeah, I agree with you. I don't know how they do it. I'm glad. I love to see them twisted like pretzels and nuts as a caucus because they're trying to
yeah,
do terrible things, right? And they're not trying to do it to balance a budget, right? Or to attack the national debt. That's all bullshit. They talk about that. They've never done that, right? The debt explodes under Trump, under
everybody.
Republicans,
Yeah,
but more so, right? More so. I mean,
yeah,
Clinton actually, turned it the other way and had a budget surplus for a few years. But, so when they say that, it's all bullshit because really what it is for tax cuts for billionaires, to extend those tax cuts
yeah,
that got us into a heap of financial trouble the first time around. And we also have to keep reminding people of that, right? This isn't them being fiscally responsible. It's completely irresponsible fiscally and kind of
morally.
in a human, yeah, morally. Thank you. So yeah, keep up the pressure. Thank you to everyone out there doing the hard work. It's honestly isn't that hard because it's just basic. It's what we do every day as docs, as regular members of the community, and it's really encouraging. I think it's
Yeah.
a little ray of sunshine in sometimes very dark days, and it's good to be a member of that coalition of people fighting for right.
Yeah, I'm gonna quote. I don't know if you saw JB Pritzker's Governor JB Pritzker, Illinois governor, my governor. His quote, or his great speech. But I think maybe we can end with his quote: "These Republicans cannot know a moment of peace when it comes to Medicaid
Yeah,
cuts." He wasn't talking about Medicaid cuts. He was talking about sort of their entire attack on the country. But let
right.
them know no moment of peace as we roll into hot Medicaid summer.
Hot
So
Medicaid summer, here we come. Yeah, well, that's a
here it
great way
comes.
to end it, and I think he's right. Don't let them rest. Don't let them sit back and get comfortable on this. Keep up the pressure. But yeah, with that, Miles, why don't you read us out?
All right, today's episode was written by Chris Savage, Dr. Rob Davidson, and me, Miles Baker. The episode is produced by Amelia Dillenschneider, Aslan Ibrahim, and Joel Bryson. Music by Annette Somerset at Dune Flower Productions. If you enjoyed today's show, please subscribe and leave us a rating on YouTube, Spotify, Apple Podcasts, or wherever you listen. Your support helps others discover the podcast. You can also share it with other doctors if folks want to get quick updates on what's happening, but they want to just listen to it. Physicians, your voice matters. Join the fight for better American healthcare by becoming a member of the Committee to Protect Healthcare. That's where me and Rob work. Visit committeetoprotect.org to learn more. We'd love your feedback. Send your comments and suggestions to feedback@pageinamerica.org. Thank you so much for listening, and see you next time.
See you
And
next
see you,
time.
Rob.